What is Protect Hawaii? Stop COVID-19? It is a grassroots campaign asking the governor to change strategy from mitigation to eradication of COVID-19. Currently, the state strategy is to try to keep COVID-19 at a manageable level. This strategy is not working. This virus is extremely contagious, and because of that, the logistics, time, cost, and labor required to manage it correctly is many times more than what is currently being done. It is obvious mitigation is not working and is no longer a realistic strategy for moving forward. It is imperative that the state change our goal to completely stopping community spread and then preventing new sources of COVID-19 from coming into the community. This would be following the same strategy that New Zealand took. This is the most realistic plan and could be easily implemented in Hawaii. We are asking the governor, mayors and state lawmakers to formally make eradication of COVID-19 the goal. Hawaii is extremely isolated. The one advantage this gives us is thousands of miles of ocean that surrounds us. This makes it very easy to detect and contain COVID-19 as it enters the state. There have been many plans submitted to the governor that could achieve this. They all include requirements for a strict quarantine, multiple tests, and closing current loopholes that have led to an increase in community spread and cases. Our isolation also has a downside though. If we do not adopt an eradication strategy, we will be extremely disadvantaged. We cannot easily obtain more resources if they are urgently needed. We have limited hospital capacity and facilities. Public health impacts. Honolulu is a large urban area where the virus has been spreading widely and could easily continue to do so. Meanwhile, much of the rest of the state is rural, isolated, and without adequate healthcare resources. We also have the largest number of multi-generational homes per capita of any state. This puts our kupuna at a much greater risk than any other state. We have many at-risk and vulnerable communities. They statistically have a much higher risk of death and permanent disability than average, depending on the strategy we take. Our story could be one of great success with COVID-19 or one of extreme tragedy. This is why a strategy of stopping COVID-19 is of the utmost importance. School impacts. We know the safest way to have in-person school is to stop community spread. The current mitigation strategy will not and cannot stop community spread. This is unacceptable for our students, teachers, the staff, and all their families. We need an eradication strategy so that our students can have an opportunity to have in-person school, sports, hula, and other activities as safely as possible. We cannot sacrifice our students and their very short childhood in order to reopen. We must not place the desires of business ahead of the well-being of our students, teachers, and other essential workers and residents. We know distance learning most negatively impacts students who are underprivileged or disabled. Distance learning widens the opportunity gap for kids from single-parent and lower-income families. The mitigation strategy will inevitably force us back to an unplanned 100% distance learning platform for the safety of all involved. The current plans will hurt our children and further disadvantage those who already struggle the most. We need to adopt an eradication strategy to give our students the educational opportunities that they deserve. Economic impacts. It is impossible to have an urgent ongoing public health emergency and a healthy tourism-based economy simultaneously. If we have a high rate of community spread, most tourists will not want to visit, and those who do may become ill while here, further burdening our limited healthcare resources. If we allow our numbers to continue to exponentially increase, then we are very likely to be under a travel ban from almost every foreign country that has controlled COVID-19. Foreign tourists tend to spend a lot per capita and are a significant portion of our tourism-based economy. We will eliminate that portion of the economy if we continue with the mitigation strategy. On the other hand, eradication would attract tourism because Hawaii would become one of the safest travel destinations. And we could reopen for tourism safely. It would just require that we take precautions, such as requiring that visitors quarantine at designated hotels until they've tested negative. As for the 77% of our economy that is not tourism-based, that too is placed at risk by limiting our goal to mitigation rather than eradication. Every time cases start to grow exponentially again, as they will continue to do under a mitigation strategy, we must reimpose increased restrictions, eventually getting to the point of stay-at-home orders. The resulting uncertainty and unpredictability makes it extremely difficult for local businesses to survive and has potentially devastating economic impacts. This makes it obvious that the current strategy is extremely risky. A much more realistic strategy is eradication, which would allow businesses to adjust to the new economy in a stable, predictable way. This is not the first pandemic or disaster to hit Hawaii, and unfortunately will not be the last. Our response to every crisis needs to be focused first and foremost on the safety and well-being of Hawaii's people, particularly its most vulnerable residents. That is why we ask our governor and mayors to formally adopt the goal of eradication so that we can protect Hawaii and keep Hawai'i COVID-19 free.